Շատ սիրելի հոմի ընկերուհիներ եւ բարեկամներ, մեր հոմի Տորոնտոյի բնամասնաճյուղի ընկերային ծառայության հանձնախումբի անունով բարի եկած եք բոլորդ։ Ուրեմն ընդհանրապես բոլորիս փապակն է, որ լամենք եւ կամ մեր ծնողները, սիրելիները հասնենք խոր ձևության եւ մնանք ապրիլ, կարենանք ապրիլ մեր տուներու մեջ։ Եվ նաև վայելել առողջ անկախ և ինքնաբավ կյանք առանց հերելալու մեր սիրելիներու, մեր զավակներու վրա։ Բայց գիտենք անշուշտ թե հաճախ կարանտինին դժվարություններու դիմաց։ Ուրեմն այս բոլորը երբ որ մենք մեր ժողովներու մեջ մտահոգությունները կխոսենք, թե ինչ ծևերով ունենք մեր քաղաքին օգտակար լալ, ուրեմն մեր հանձնախումբը հարմար նկատեց գազմագերվել այսօրվա ձեռնարկը, հուսալով, որ մեր փոխանցելի տեղեկությունները օգտակար կլան մեր բոլորին, ըլլան ներկային և կամ ապակայի տարիքներուն և թե հուսալիչու չէ պարադել գարկումը մտահոգություններ։ Ուրեմն մեր այսօրվա տասախոսն է ընկերուի Լարիսա Գրիգորյան Մուրադովան, շատ հագիր ծևով իրեն մասին երկար մի չխոսիմ հայերենով, որովհետև անգլերենով մի դիտնենք։ Ուրեմն ընկերուի Լարիսային արմատները հյուսիսային Արցախի Չարտախլու գյուղեն են։ Ինք պատմեց, թե իր մոր մեծ հայրը նշանավոր անձնավորություն մի եղած է, և ջանցված է Ղարախան անունով, շարունակությունը անգլերենով։ Dear ARS Ungaris and friends, on behalf of the ARS Social Services Committee, I would like to thank you all for attending today's event. And a special thank you as well to representatives from M&M Medical Supplies, the Arab Community Center of Toronto, as well as the hearing aid source for agreeing to be present today. You'll have the opportunity at the end of the event, and maybe some of you were already talking to them. You'll be able to reach out and ask your questions and find out more information about what they offer and how they can help you. So, as I was saying in Armenia, most of us, as we enter old age or we go into old age, we hope that we will continue living in our homes. We hope to lead independent, fulfilling lives, and most of us don't want to be a burden on our families. So keeping that in mind, our committee thought that it would be helpful to, that today's presentation on this topic would be helpful in relaying information that would help us continue living safely in our own homes and to lead fulfilling lives. Our today's presenter is Ingrid Larisa Muradova, Grigoria Muradova, sorry, and I will be reading her biography in her own words. She does have an interesting story. Ingrid Larisa belongs to the noble dynasty of Karahan. So, and this is how this person was known. His last name is Giragosyan, however, we do not know his first name. And this is Ingrid Larisa's great-grandfather from her mother's side. Karahan was a famous businessman and one of the investors of Artsakh in the 19th century. He also was an individual who financially supported the building of the Eiffel Tower in Paris. Larisa's roots are from Çarkağlı, a village in northern Artsakh. The region is very famous, and it was a summer residence of Armenian Catholicos, and is also the motherland of Archbishop Sepazan Baker Martirosyan, two marshals of World War II, Hovannes Bagramyan and Hamazas Babajanyan, as well as 12 generals and 170 heroes of the Soviet Union. So it produced quite a few known individuals. Larisa acquired a passion and love for medicine since she was a child, watching her grandfather accepting and treating patients. With over 30 years of experience as a medical professional herself, she has dedicated her life to continuing the family legacy. Her educational path started in 1980 and continues until now. She earned her license in nursing at the age of 18 in Russia and became one of the youngest medical professionals. She championed initiatives and was accepted in the most elite medical facility in Stavropol, Russia. Larissa advanced her education, earning a degree in law and representing individuals in court. Years later, after immigrating to North America, Larissa furthered her education in nursing in Canada and earned multiple certifications, including wound care, basic and advanced foot care, geriatric care, and community care. Larissa has been an ARS member since 2000. She first joined the ARS Windsor Robina chapter, then in 2008, she moved and transferred to our Toronto Robina chapter. You'll notice this is not an error. There are two Robina chapters in Canada, one in Windsor, one in Toronto. Larissa has one daughter, Tamara, who is here with us, and two grandchildren, Violeta and Georges, and they're here as well. We're happy to have you. Larissa believes in empowering everyone to live a happy and fulfilling life, utilizing God's given attributes, resources, and talents. Thank you, Larissa.
Thank you.
The stage is yours.
Բարև սիրելի մեր ընկերների and ներկայներ։ Շատ ուրախ եմ, որ մենք բոլորը այստեղ ենք, մի քիչ մի բան սովորենք այսօր։ All my life I dedicated to nursing, therefore I am happy and glad to share whatever I learned with my community, as I feel this is my family. And I hope everybody who has aging a family member in home will be taken care of from safety point and live happy until the moment God make decision, judgment. So with assistance and encouragement of ECCC, I was allowed to do this presentation and to address all those important topics for people, aging people and disabled people to live in their homes safely. As we know, unfortunately, due to COVID situation, we lost many our elderly people in long-term care where we did not have chance to say last goodbye or to even give last hug. So this is preventable if we can educate and learn more how to take care of our elderly, our aging parents or our disabled family member in home settings, and to be there as a home is always a place where everyone feels secure and even walls helping them at every moment, except when safety become an issue to live in home. That moment I would encourage to consider placement in long-term care. So I put together a few topics and how we can provide and ensure safety for our aging population. Unfortunately, we're aging too, so we have to be prepared for that as well. So first of all, I would encourage everyone to have a healthy lifestyle and to maintain life like who's working life-work balance. Start from even nutrition point, physical activities. Consider their mood might change due to weather conditions, lack of vitamin deficiency. All this could be prevented if we just consider and follow the guidelines which is given by pharmacological factories and researchers. Staying active, doing like daily walking exercises will improve and mood and physical mobilities and prolong life, healthy lifestyle. Simple, every day 10-15 minutes walking exercise, not too much. Too much better, but at least that. It's not necessary to attend gym for everyone, but at least walking fresh air, that have huge impact on human body. Stay social, as isolation leading to depression, one of the leading of depression, along of course with electrolytes in the balance of the brain. But if we isolate an individual, that individual mood will lead to depression and condition decline. So if we know anyone who is living alone, or if there are some families who work in daytime and they're aging parents alone, there are lots of activities available in community settings, along with attending here and somewhere, depend where they live, every community center, they have groups available based on their preference of what type of activities, playing cards or some puzzle or just even a Montessori program, everything available. And it's free of charges for our community. We just need to utilize, we need to know the sources available. And transportation, everything arrangeable at minimum charge. I believe TCC takes $2 for one way. So everything is doable. We need to consider that because as we went through this social isolation through a pandemic situation, you probably noticed everyone, even who were working, how it was hard for people to be isolated, not to communicate. And can you imagine if that elderly person or who is disabled, they already lacking that interaction and limited double, it's very painful. Because I, as a nurse, I do visit clients in community and I see how they suffer. I always empower them, I provide all sources, up to connect with people on internet. They have the Zoom, they have Skype. Just interaction is already improving their mood and improving their whole lifestyle. We cannot point it out, this will help or that will help. We have to look to human body through whole perspective, everything. So please consider. Utilizing help, when I indicate utilizing help, it means we have all sources help available set up by our government. We're so lucky to be in Canada when we have that social assistance available. It starts from PSW services, nursing, physiotherapists, occupational therapists, rehab if needed. All those, but our community, statistics from my research indicate we're limited to that due to our cultural belief. We don't reach out to utilize those sources, although all those funds available. So the point of my presentation to make awareness, this is possible, needed, and utilize them because everyone who's working, we pay taxes and part of that taxation is go to help community. There where we have to look. So in order to get those services, they're not too much needed. Your family physician can identify and refer to CCAC. Now they call Lean, and I believe they will change their name again. But it's the same. It's government agency who's arranging clients' care in their home settings. Or it can be arranged from the hospital settings when client discharged or patient discharged from hospital. In order to be safe without a complication in home settings, social worker requires to complete application, and with that all the services available. Again, it's free of charges. It's for our community. Please utilize them. Because we understand that people living in families, it's beautiful, good, but it might be very hard for that caring family 24 hours a day ongoing to provide services. We do have some family member who is not working, but still to be 24 hours a day caregiver, it's very hard emotionally, it's affecting well-being for whole family. We have to recognize that working parents, or like if it's an individual who's working, have to take care of their aging parents, same time have to take care of needs of family, children, it's too much. So sources available, just reach out, okay? And also when we talk about utilizing sources, we need to know what exactly needed, like it's personal care or it's home care, which personal care is assisting that individual with bath and shower, because safety is one of the huge concern. And home care, which is housekeeping, washing dishes, doing laundry, that is different. So housekeeping services can be arranged on government-funded basis if the limited financial status of that individual, or on privately funded basis. But still, so it's available. No need to overwhelm yourself as you having anybody who at home needed your care. And also there's possibility to, as your loved one might meet criteria for government-funded services, to withdraw for direct care. In case if something is not to your own satisfactory, you can collect that money and hire on your own individual. So everything is available. Please utilize, okay? Providing your care for your loved one in home settings, you have to consider multiple aspects in order for them to be safe. It's not only to provide meal and assist them to bed. We have to identify if your loved one lacking some condition like poor vision. Obviously, if they have poor vision, they will be prone to falls because they don't know where to go. They won't see what underneath their feet, and that causes entrapment, slippery fall, injury, up to fractures. And it's a very quality life decline of that individual, and very painful for family to see that suffering too. In this case, family don't have any choice as to place their loved one to nursing home, because care is required more intense. So this is preventable, okay? Make sure proper lighting, make sure no loose carpet or anything on the floor, no cloudiness. At night time, make sure light is there available as well. Then consider. If your loved one become incontinent, if it's urinary or bowel incontinent, there's devices available to assist. Unfortunately, it's due to aging process, it's nobody guaranteed from those conditions. And it starts from physical activities, if they lack in physical activities, to neurological disorder leading to that condition, and people not able to control. But there's support available as using incontinent breaths, and in some cases maybe to do training program, which after each meal, 20 minutes after meal intake, if you assist your loved one for toilet, then you will prevent them being incontinent, because it's affect their dignity. That nobody will be happy to become incontinent, and it's not. Unfortunately, we have to face, this is what in reality, it's human body, we need to consider in order to prevent further complications for their system. If any individual sitting in for prolonged time in wet breaths, incontinent breaths, it will lead to skin breakdown, from dermatitis to pressure ulcer and infection, and it's more difficult to treat. So again, that is all preventable. Toilet, 2 hours or 20 minutes after a meal, and then on 2 hours basis, and this way bladder or bowel will be able to respond to those stimuli and get that memory of, although some individual might be severely impacted with neurological disorder, that's exception. But if it's not severely, then it's retrainable. As we do train people with stroke how to recover, rehabilitate. Same training with bladder and bowel, we can restore that function. So walking, the other aspect of fall, most common fall and leading to fracture injuries. If you elderly or aging a loved one not able to stand, it's not because they don't like to move around, because their muscles get weak and they're scared to fall. Therefore, they're refusing or reluctant to be engaged in those exercises. But even sitting position exercise will help them. Start from their toes, moving their feet, moving their ankle. Small thing like constant on daily basis, it will keep their muscle tone in place, and they can stand. able to stand for 5 minutes on their own, please don't force them to walk, to go there, move around. They won't be able, they will fall, get injured, and unfortunately, who's providing care as a result might get injured too. So those individuals might need assistive devices for walking, for mobility, even for transferring. But it's you who live with them, you who will recognize, and if you recognize at time that there's some impairment or some limitation happen, time when to seek for medical attention to prevent from deterioration, because there's some medication available to keep muscle tone in place, improve, and to first of all to identify what causes it. Okay, if any active, physically active person suddenly become weak, there's something neurological happening, might be from stroke, from tumor. This is first sign. So, and please be aware and share with your friends, with your other family member, as we need to know. This is simple things, but if we don't know, unfortunately, complication is there. Environmental factor also plays huge role in assisting our loved one to take shower. For instance, if they're weak and they feel that they're gonna fall, they might decline to take shower. But if we place in their home settings that shower branch to sit, bar to hold, that will help them and they'll feel confident that I can do it, and with that they will take shower. And we have vendors here who's available to assist you with those devices. Please refer after and utilize the assistance. They took their time to come and share with you what they have and how can be helpful. And for every individual, it has to be arranged on personal level, because their height, their weight, it's all matter, okay? We cannot use whatever was presented and used for my grandmother, and would be usable and suitable for me. Every individual is, on individual level, they have to assess. Again, all this available through CCAC. If you identify that you loved one needed those assistance, your doctor can send referral to CCAC that for occupational therapists, again, free of charges. They will come, assist, advise, and if needed, the cost can be addressed as well. You don't need to pay, or maybe you will pay some fraction of it, as there's some association available to assist with old age disability and WCB as well. They might accommodate in order to compensate us. And some of us who's working having private insurance also can be covered by private insurance. Again, if you will be referred to CCAC, the case managers, they will look into all that and advise. Applications available, just need to utilize them properly. Also, please consider a multiple medication. It's never been the best choice to stay healthy, because any multiple medication will affect your kidney, liver, or gastrointestinal system. Less medication take, more healthier lifestyle, healthier food, that would be more better for human body than taking those medications. And of course, there's some medication which required, I'm not against all of them, but some might require, for instance, if anyone have a blood disorder, they need to have. If anyone having some muscle of their heart muscle weakness, they need to have. But to take like on different level from this medication to cover it, please consult with your doctor and with your pharmacist to minimize as much as possible. Because trust me, all medications affecting our organs. And that is not, especially with aging, where the metabolic process decrease and they don't absorb and move from body as required, and some of them causing calcification and affecting, like I stated, liver, kidney, it's very common, gallbladder, and gastrointestinal system. Okay? So, what's come to pain management? Of course, no one should suffer. No one should suffer from pain, as pain is indication of our body that there's something happening, from simple infection where internal organ expand, inflammation causes that pain, to even tumor. So if it's not addressed at time, then it will lead to complication. But pain medication we have to take very cautious, because they have side effects from delirium, hallucination, and it might permanently damage the brain surrounding tissue as well. So we have to be aware, and unfortunately some new generation who were introduced to some pain medication might become addicted. It's really hot topics these days, who is addicted to those drugs. But some environment, in family or outside, force them to go and to relieve their needs to satisfactory using those medication or street drugs to be happy. We need to educate this is not the best, because it will lead to permanent damage of brain if not addressed at time too. Sometimes be aware if there's some pain medication or narcotics used for our aging elderly population at home due to any condition, the young generation might abuse it. So you need to calm and to keep them safe, make sure it's not accessible to them, and to keep our generation safe as well, okay? This is just small coverage. Maybe everybody aware of that, but if you don't talk about it at home, and they don't know, and then we have many families who are struggling with kids who are addicted to certain drugs, and their life quality decline, and we did not come to this country to suffer. We're here to enjoy life, as all sources available. We just need to utilize. We need to educate our children and everybody around to be goal-centered and achieve that, and help them to achieve that goal. And when happy family, then happy community, happy country, that should be our goal, and we have everything to achieve that. Also, I would like to little bit talk about more what type of services available from CCAC in order to assist our community who need it. It starts, like I stated, housekeeping, doing grocery shopping, personal support, medication from reminding to administration, meal preparation and assisted with feeding, nursing, all kind of what's required nursing services that would be arranged, because cannot be done by family member. Please remember, if there anything required injection or do blood sugar check and administer that insulin based on sliding scale, it have to be very, very carefully monitored, because this is affecting whole system for that individual with diabetes. Transportation also can be set up, and if your loved one who is lacking mobility and therefore they cannot go outside, which is false, with proper arrangement of transportation, the TCC is, TTC is only $2, I believe, they did not increase, right, and they can, and take that individual to location needed and arrange time and pick them up to your location. Okay, all this available. Dementia support in home settings also available, but to be honest, with dementia, if it's a progressive dementia, progressive Alzheimer, in this case, I would encourage to seek for long-term assistance, because safety becomes issue. Any individual who is affected by advanced dementia or Alzheimer's is at high risk for elopement, and we wouldn't like to see anyone got lost, frozen, or dehydrated, and
lose them due to that condition. So in this case, I would advise to seek for placement in long-term care. Other than that, if the individual affected by dementia or early stage of Alzheimer's diseases can be taken care of in their home settings by using, like if it's washroom, indicate toilet on the door. If it's bedroom, indicate the bed on the door. If it's kitchen, indicate plate. It will trigger where to go, and also everything have to be by picture. As statistics indicate, visual is more stimulate and more effective than if you write or if you say to them. I would like to, regarding dementia, bring one scenario which will, I hope it will change your idea about dementia. I was working in one of long-term care Armenian unit, and when I came to room, there was wife and husband in the same room, and wife was there living with him just to supporting us. That is our culture, live together, wife and husband. So his blood pressure always was running low, and he required to check blood pressure, mix whole medication or administered, although he was with considered advanced dementia. So when wife asked me from where I am, I explained from where I am. She started crying, and blood pressure monitor was hooked up to that individual, and his blood pressure was reading low numbers. When I explained from where, and she hugged me and started crying. She said, 70 years ago they left that place and never went back. And she was crying, and suddenly his blood pressure went up. So we think that people with dementia, they don't understand, and their brain affected so significantly. And unfortunately, how some can be treated, it's considered as an abuse, but because we don't understand that why these people with dementia, Alzheimer's don't respond. No, their brain not that. They're just not able to respond to our normal way how we communicate. They perceive everything, but they cannot state. So that was 100% evidence, and from there, I always advocate for individual affected with dementia and Alzheimer's. Please treat them with respect till last minute of their life. They perceive all surroundings, same and hear and understand, but they cannot respond and state it. I am feeling this way or that way. Therefore, if anyone affected with dementia, they are not able to state that I'm in pain, I am thirsty, I'm hungry. They're gonna be, it will show their physical aggression. They might scream, they might yell, they might kick, they try to punch because they need that help. They cannot state, I am in this condition. So please consider, okay? If, again, based on my experience, when I was working in long-term care, I ensured they not in pain medication address, make sure they not in wet, brief, but not in, they dry, and make sure they not stressed and hungry. And trust me, everyone who I took care of that long-term care and after loved me, and because they knew I really was there for them. And I'd like you to understand and to treat anyone who you might come a witness or cross with dementia, treat with respect as is they perceive everything. Unfortunately, the research going, and to be honest, in Europe, in Russia, they have a way how to decline that progression of that condition, but it's not approved in North America. And this condition can be, if identified at time, addressed and to prevent from deterioration. And when we're talking about dementia, it doesn't mean that any individual who is memory decline having dementia, who is not responding properly to your question having dementia. To confirm that diagnosis, proper investigation need to be done, like X-ray and CAT scan, and with that, only with that, because simple urinary tract infection might cause individual to become confused and with memory problem. And again, from my experience, I did witness when doctor mistakenly diagnosed individual with dementia while she was having urinary tract, advanced urinary tract infection, yes. And this we have to be very careful when doctor diagnosed. I'm not stating not to trust them, but to question a few times based on what, why. Okay, as we know, improper pericare might lead to urinary tract infection, especially if a female after incontinent cleans from the back toward front. This way, E. coli bacteria introduced to urethra and causing urinary tract infection. If any individual who is incontinent not change and wash at time, same bacteria introduced to urethra and causing urinary tract infection. From their cognition and all mental state is declining. It's preventable. Okay. Also, lack of or limit proper nutrition and fluid also affecting our mental how should I say capacity to respond to all stimuli. So we have to consider. Therefore, we encourage make sure every individual drinking enough fluid, if not restricted. There are some individuals who have a heart condition or kidney condition, yes, they cannot consume certain amount, but if that's not identified, every individual should drink at least 1.8 liters a day, minimum, for human body for proper functioning. If it's not happening, you will feel confused, memory decline, up to skin turgor, you can check hold. If that skin is not smoothing right away, this is sign of dehydration. Simple, okay? So the reason I'm sharing all, I can talk a lot. I love my nursing, I can talk a lot, but this is simple what you can identify and do, how you can prevent any complications. Now, the one topic I would like to bring your attention as well to dealing with individual with diabetes. Again, unfortunately, not right choices of meals even that might lead to diabetes. If we feed our loved ones with sweets and only sweets and also those carbs, that might affect our pancreatic system. Second, some infection, it's viral or bacterial, might affect our pancreas and also lead to diabetes. Diabetes is one of the leading condition to death, and it's not reversible. We need to be aware in order to maintain that balanced, controlled lifestyle and to prevent complications. Because unfortunately, with diabetes, people prone at organ shutdown and become blind. All this due to improper food intake. So it can be prevented. So when we're dealing with individuals with diabetes, we have to be sure that we got their blood sugar level under control. So at least on monthly basis to do blood work. If they on oral medication or if they on insulin, then they have to check on weekly basis if it's not sliding scale to identify, because insulin might vary from multiple conditions. If an individual with diabetes will have infection, blood sugar reading will be high, insulin dose need to be adjusted. So please be aware of that. Make sure those individuals' skin taken care of properly, because leading cause of amputated legs is diabetes, complication of diabetes. People with diabetes, due to nerve ending, they die. They don't feel fingers, they don't feel their feet. They might step on something sharp and cause up to gangrene and still don't recognize that they have a problem till infection goes to bone. Then they recognize, but it becomes too late, leading to amputation. Therefore, individuals with diabetes require special food care done by food care nurse or therapists, but no other sources. And as they might clip or cut or file too short that nail, affect that nail bed, and because they don't have defense in their system, bacteria, especially fungus, penetrate fast and it spread fast. And it's very hard to cure. Although I can say proudly, lately I was able to help one of my clients, not client, friend, with diabetes to prevent from gangrenous condition, and now it's almost closed because when it came to my attention, I identified and I recommend, and so with what's required to do, we were able to close that wound and to prevent this from like he's normal now, everything resolved. So therefore, please, if any individual with you have a family member or friends with diabetes, they have to check their feet every time they take a shower. At least twice a week shower requires. Make sure if there any redness, any cause, any groin tonus, it have to be addressed at time before it's too late. Also, the improper footwear affected and causing friction and skin breakdown as well. As with aging, we know that our muscles more relaxed, and if I was wearing regular shoes, maybe in 5 years I need wider shoes. So make sure that footwear according to that the size which needed. Never narrow for beauty. Sometimes some ladies do wear shoes to have beautiful outlook, but then keeping and wearing them back, and yet that friction might affect skin and cause skin breakdown and lead to diabetic foot ulcer. So if we have individuals with diabetes, their footwear properly have to be adjusted. If there any ulcer, that they need to have proper insoles, but that should be done and recommended by chiropodist or even foot care nurse can make suggestion and to address in order to prevent complications. Okay. The other topic I would like to discuss regarding oral care. Like we sometimes, unfortunately, again from my experience, I noticed that many individuals, elderly people, they refuse to eat. And family trying, why is that? But when you check, they might have the lesion. As if oral care not done properly. Just even brushing those teeth after each meal, its bacteria stays there and start growing and penetrating through tissue. As with aging, all defenses decrease, and they having those gingivitis and not able to chew their food, or they having some inflamed gum due to problem with teeth. Nobody pay attention and they refusing to eat. With that, when they don't consume enough food, the condition declining, not proper nutrition. So, in ideal, after each meal, oral care have to be done, brush teeth. If it's dentures have to be removed, brush and place, and make sure not too much adhesive applied in order to hold those dentures, because that also affected chewing pattern. Who is having dentures, twice a year those dentures have to be cleansed properly. Just brushing, twice a year, every 6 months. Because if it's not done properly, those bacteria, fungal accumulate there and affecting oral cavity as well. And every 2 years, denture check need to be done, because with aging, individual losing or gaining or it's changing, the size, how it's physiologically affecting those muscles, and previous dentures no longer usable. We need to pay attention to those small things, but very effective, just for simple to make sure that individual will consume properly food. So in some cases, our loved one might become state when they're not able to swallow. Again, it's not because they don't like to. We have to seek for speech-language pathologists to identify why they're not able, why they don't like to eat. Because with aging, with muscle loosening, they're just not able to swallow. It will be stuck in their throat, and therefore they're refusing to eat. again, with proper intervention, we would be able to address that, provide thickener fluid, mixed texture diet or puree texture diet, and they will consume their nutrition as needed. And if there is no contraindication or no condition which leading to palliative care, then maybe even gastrointestinal tube would be required. I'm sure no one would like to lose their loved one. So let's do everything to assist them to be healthier and to live happy life, as everything will come from us. Trust me, that I had my grandma, and she was very lovely lady. I promised her, I said, Grandma, when I go to state at that time, I was coming to state, I said, I'm going to take you and we're going to live together, because she raised me. She said, I bless you, go with it. But unfortunately, she died. And she was the type of person, she never would ask for any help. She didn't like to be burdened to anyone. If I wouldn't come ask to Grandma, would you like to drink? She wouldn't ask that I like to drink. So I believe I don't know if it's belong to our culture or but to my culture, I notice it's very common. So please be sensitive to your loved one. Be it's doesn't cost anyone just to come, to hug, to smile, and that will make their day. Because if who is working, live it and go on day alone with all their thoughts, and again, unfortunately, we'll get to that point too. We're not guaranteed that we're going to be better. If we won't set up today the sample, how it should be done the best way, our children, my grandchildren here, I hope they hear and they will follow that. I rely on it. And I hope everybody else will consider how to make their loved one happy. Because our parents, grandparents done everything for us to keep us happy as we here, we're healthy, thanks to God. And now it's time to consider the best and give to them till end of their days.